Hi, I'm Dr. Lorenzo Cervantes. If you're watching this video, you were probably referred to me for a problem with your cornea, specifically corneal swelling, also called corneal edema, or a condition known as Fuchs corneal dystrophy. This video will help you understand what the cornea is, what causes corneal swelling, and what we can do about it, so that when we meet, we can focus on your specific situation and the best treatment plan for you. Your cornea is the clear front layer of your eye, like a window that lets light in and helps focus your vision. The cornea has several layers from the outside to the inside, but the one we're going to talk about today is the inner layer called the endothelium. This layer is made up of a single layer of cells that acts as a waterproof barrier, preventing fluid inside the eye from leaking into the rest of the cornea, which would absorb it like a sponge. When that barrier breaks down, fluid seeps into the cornea and the tissue becomes swollen, which leads to blurry or foggy vision. The most classic symptom of corneal edema is foggy vision, when you wake up in the morning, that gradually gets better as the day goes on. In more severe cases, swelling can cause pain or discomfort, and can even cause painful blisters on the surface of the eye. We are all born with a set number of endothelial cells, and we don't grow more. They don't regenerate. They don't divide. We have what we have when we're born. Over time, everyone loses some of these cells, just as part of normal aging. That can happen because of eye surgery, especially surgeries that take place behind or through the cornea, a low starting number of cells, or the most common reason, a condition called Fuchs corneal dystrophy. Fuchs dystrophy is a degenerative condition that causes endothelial cells to die off faster than normal. Many people have it and don't realize it until they're told by an eye doctor or they start having symptoms. Most people with Fuchs dystrophy will never need treatment, but a small number will lose enough cells that the cornea becomes swollen and the vision suffers. Right now, the only way to treat someone who has lost too many endothelial cells is to replace them, usually using donor tissue from someone who's passed away recently and generously donated their eyes. We perform a type of partial thickness cornea transplant where we insert a thin layer of healthy endothelial cells into the eye. These cells attach to the back of the cornea and begin to do the work your original cells could no longer do. This surgery is done in an operating room and takes about an hour. We don't use stitches or glue. Instead, we use an air bubble to float those donor cells up against the back of the patient's cornea and help them stick. For the first several days, that bubble is like your bandage. You're allowed to move around, eat, drink, go to the bathroom, but when you're not doing anything, we'll ask you to spend some time looking up at the ceiling to help the bubble stay in position. I'll see you the day after surgery, and again about a week afterward, which is a really important visit, because that's when we find out if the cells are sticking. If they're not, we can replace the bubble to give it a second chance, something we do in about 10% of cases. As the cells start to do the job, you'll notice your vision improving week by week, month by month. Most people notice significant improvement by 3 to 6 months, which is far faster than the older full-thickness cornea transplants that used to take up to 2 years for full visual recovery. I'll continue to see you at regular intervals, a week, a month, several months later, until eventually only once or twice a year. You'll be on eye drops for the rest of your life to help protect those new cells and reduce the chance of rejection or inflammation. As with any surgery, there are always risks, including infection, pain, bleeding, inflammation, graft rejection, the possibility of needing more surgery, or in rare cases, vision loss. These risks are very low, but not zero. That's why we're having this discussion, and why I'll continue to monitor you long term, to catch anything early before it becomes serious. The most common short-term effect is dry eye, which happens to some degree after any vision correction surgery. Symptoms of dry eye can include grittiness or irritation, redness, fluctuating vision, or sensitivity at night. That's why it's important to manage dry eye before surgery, especially if you already have symptoms. We'll go over instructions to help with this, including lid hygiene, warm compresses, remembering to blink during screen time or reading, and using preservative-free lubrication drops. For some patients, we recommend a more advanced dry eye treatment plan before surgery to minimize post-op dryness. We can go over that in more detail when you're here. I hope this video helps you understand a bit more about the cornea, corneal swelling, and what might be happening with your eyes. When we meet in person, I'll examine your cornea, look at your specific situation, and talk with you about what options are available to improve and protect your vision. Thanks for watching. I look forward to seeing you soon.